bring up that right. Oh, there we go. Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois, and I'm here with Mr. Mike. Great patient, working his tail off, getting better. Mike is actually a firefighter. So came in, obviously his job's extremely demanding, right? So when he came in, had some pain kind of starting just underneath that rib cage there, traveling down into that low back, kind of hooking around, right? So make sure, did the exam, took a look at them, make sure it didn't pull any muscles, make sure there was no spinal damage, disc herniations, anything like that. And he's actually been doing great. Yep. PT-wise, been working through, started him pretty light so we can build them back up, have a little fun with them. Kind of what's that experience been like for you?
It's been good. I could barely get my shoes and socks on when I started, and now I'm getting pushed in the gym and hopefully get back to duty soon.
Yeah, there you go, right? So it's one of our goals, obviously. We got to get him back to work. Like I said, job being very demanding. We know there's things that you can't account for when you are working, so we want to try to mimic that here on the rehab side of things as much as we can. So even starting today, we're going to push you a little bit more, which is a good thing. Get you back to work as soon as we can here. So today what you guys are going to do is see how we've been getting him adjusted, working with that low back a little bit, moving into that thoracic spine, the mid back, and then as soon as we're done with him, he's going to get after that rehab and get after it today. Ready?
Ready.
Face down, sir. All right. So with Mr. Mike here, like we said, the pain started real bad right up in here, but then all those muscles spasmed up and things kind of traveled into the low back. And then with taking our x-rays, making sure everything was clear, we saw that we did have a little bit of disc degeneration, things like that into the low back, just incidental type findings. So we're going to help him with that as much as we can as well, since he is already here. So we're going to start with a little bit of flexion distraction. You guys have been watching our channel or Instagram long enough. You've seen me do this, and I'm going to say it every time. Patients just think it's the best low back stretch they've ever had. So table's going to come out. We work fine right there at that L5 at the lower part of the lumbar spine. We're going to drop those legs down. And essentially all I'm doing with this top hand is just blocking that vertebrae. So I'm just making sure that doesn't move. So as I flex his legs, we can get some pumping and some motion into those discs. Good. You know, this is one of those things, again, always start light with the patients. Make sure there's no pain. Make sure the muscle doesn't spasm lump at all. But 99.9% of the time, people feel great with it. And actually getting off the table, they already start to feel better after that first time. Beautiful. One more time here. Excellent. All right. So bringing that table back in. With Mike, we adjust him a couple different ways here. We're going to start in that low back, more so with the drop table. So he kind of gets best of both worlds here. The table's going to pop up underneath you. Good. We're going to bring up that right side. Excellent. Lay on your side, face me, sir. I threw you off today. Went to the other side. Gotta keep you on your toes too. All right. So again, working right at that lower lumbar. Gonna let him roll. Oh, there we go. He always makes a lot of noise. I promise. It's not as bad as it sounds. Slide toward me a little bit for you there. There you go. And we're going to actually just drop it back just a hair. Good. Same thing. Let that fall. There it was. Second effort. Come on up, sir. Nice and easy. Again, not as bad as it sounds, right?
No, it's not bad.
So, if you guys are experiencing any type of that mid-back, low back pain, or you know anybody that is, give us a phone call at that number below. If you're watching on YouTube, hit the notification bell, like, follow the page, Facebook and Instagram, like and follow, and we'll catch you guys on the next video.